that everyone is muted throughout the training, but I'm going to be showing you where you can go to type in questions should you have one. Look for a questions box. If you open that up, you should be able to type in a question, and we'll respond to your questions, towards either throughout or towards the end for sure. We'll go over all the questions.
The broadcast is now starting. All attendees are in listen-only mode.
Okay, hopefully everybody heard everything I just said, but if not, my name is Karen Craigmile, and I want to welcome you to our Remit training today. You are all in a muted mode, but I want you to know that you can type in questions today, and we'll be sure to answer those either written in the questions box or verbally for you. Now you should all also see my screen on display, the VisionWeb screen login page. But again, you are muted, and there will be times where we'll let you, or we will respond to any questions either that you type in the question box, or we'll try to go over all the questions at the end as well. So let's go ahead and get started. We're here today to talk about the Remits solution. But to get into the partner portal, when you've got, well, first of all, you go to VisionWeb.com, and to log into VisionWeb, you click this login button in the top right corner. When you do, it'll take you to a new page where you type in your username and your password and click Submit, and it takes you within VisionWeb. Now, to navigate to the partner portal, you simply hover over Payer Transactions and then glide over to the right to New Remit Claims. That's where you'll go to get into the Remits or Claim Solution area, the partner portal. So that's where you'll click. Again, you hover over Payer Transactions and glide over to New Remit Claims and click on that. Now, before I go to the next screen, I want you to know that this orange button at the bottom is where you can go to upload a batch of claims. We do need to get a initial test batch of claims from you, so you will want to click this button to upload your claims so that they can go through a mapping process to make sure everything's in order in your batches. So if you need help with that, definitely let VisionWeb know, but please upload an initial batch of claims so that we can make sure that everything gets mapped properly. Now I want to go ahead and turn the phone over to VisionWeb. I believe they have some more information for you regarding this. Anna, did you want to speak a bit on that?
Yes, thank you, Karen. This is Anna Romano, and just a couple of housekeeping items. I know that some of you sent emails over to Shane on our last two webinars, and if you haven't gotten a response yet, you should get one today or in the next couple of days. We're just a little bit backlogged, but we do hear you and we have your emails. And the other thing, if you're wondering if your account is live and in production yet, feel free to type the name of your business into the question box, and I can respond to you and let you know if you're live. We also did call some people yesterday to let them know they were in production, but if you're still wondering, just type your business name in and we'll respond and let you know. And I think that's all I have, Karen. Thank you for attending, everyone.
Thank you. Okay, perfect. Looks like some names are coming over already. So again, just look for that questions box to type in the name of your organization. But if you have any questions throughout our training today, you can also use that box to type those in there. All right, well, that's how you log in. Now what I'm going to do is change my screen, and we'll go ahead and get started with the training. So I'm pretending that I hovered over payer transactions and clicked on News or Med Claims, but I'm going to minimize this window. And now this is where it takes you within the Partner Portal area. Now, to navigate to the Remit solution, you simply glide your mouse across this blue bar and hover over Claims Processing. That's where you'll find Remits in this column on the left. So you just click it, and it'll show you the Remit screens as links over to the right. Now, I'm going to go ahead and first show you the Remits payer list. So to view it, you just simply click on Payers. Notice it took me within the Remit solution, and now those links are listed across the top, so it's very easy to move around from screen to screen. It brought me to the payer list, since that's what I selected, and it specifically brings you to a browse screen. That's what we're on. And it looks like there's, right now at this moment, over 3,300 payers on the Remit payer list. To browse through the list, simply click in the box on the left and type in either a keyword of a payer name and hit enter or search, and you'll see it will pop up any payers that have that word in the name. It found 24 that have Aetna in there, or like I say, search with a payer ID. And you might get different responses though, keep that in mind, so the results may vary depending on which one you use. For example, it found 8 of them that use 60054 as the payer ID. In fact, the bottom 3 don't even have the word Aetna in the name. So just keep that in mind that the results may vary depending on which you use, a name or an ID. Now, this is the universal payer ID in parentheses next to the name. Sometimes they have an external ID that's a whole different number. You would, if you want to search for a payer using the external ID, you need to put it in this box on the right. You don't put external IDs over here. So just be aware you would want to try typing it in here and click search to look for one with the external ID. Now this apps column shows you initials that make up our different solutions or represent our different solutions. So for example, if you see the word peers, that lets you know that that payer is on all 5 payer lists. The P represents professional claims. I means that payer is also on the institutional claims payer list. E means it's on the eligibility payer list. R stands for remits, of course. And S is for claim status. So you could see any combination of these letters in this column representing the different solutions. But that way you don't have to go to each solution one at a time and do a separate search. You can see at a glance if the payer is on any other payer list. And this column will tell you if the payer requires enrollment. Well, here's the thing. Every single payer on the Remit payer list does require enrollment. So all 3,397 or however many it was, they all have a yes here. You do need to get that enrollment activated before we can start to receive your remit files from the payers on your behalf. So if you need help with any enrollments, definitely let us know. To the right of the outbound format, if there's a note link here, you can click it to just read some extra details about that payer. And this column will tell you how or if that payer allows dual clearinghouse enrollment, yes or no. What does that mean? Well, if you glide your mouse over the titles, notice it gives a little description. It means, will the payer send remittances to more than one clearinghouse at the same time? Yes or no. So if there's a no there, that means you do need to terminate your past clearinghouse enrollment before you can specifically get enrolled through ZerMed with that payer. And this column you can ignore for now. That's for a separate solution called Claim Attachments, which is for workers' comp or auto claims only. So that is completely separate. And this column or this drop down isn't very useful actually on this screen because every payer does require enrollment. So if you click yes, they're all going to show up. Now I'll remove that ID and click search to bring back the whole list again. Now there is a printable version, a printer-friendly version. If you click printable, it will pop that up in a new window. Or rather than printing it, you could download to CSV. If you click download, it will populate the data to a spreadsheet for you. There's also an update screen. If you click updates, this will show you any payers who have recently become activated or been added. I'm sorry, scratch that. This is new payers who have recently become activated on the payer list, been added to the payer list. So if you see a payer has been activated, it means it's recently been added. Now occasionally we do have to deactivate some, so you may see that as well. So these are the payers that have most recently been added in the last 90 days. And each user can see this listing. It will have different highlighted payers as well. The highlighted area are payers that are new since the last time I visited the screen. So each user will see a different grouping of highlighted ones. So the last time I was here was on January 10th. These are new since then. So it just gives you a heads up as to who the latest payers are and what action was taken. Were they activated or deactivated? So somebody asked, why do we need to look at payers under Remits? Well, like I say, this will tell you if a payer is on the list, then that means we can receive remit files from that payer on your behalf. So you can get electronic remits for those payers. So that is the payer list for Remits. Now let me take you over to the far left to the dashboard screen. And this dashboard is basically an overview. For example, it'll show you under Action Center how many new payments you've received and how many new download files you have waiting to be auto-posted into your practice management system. Now, if your practice management system has auto-posting capability, that is. If you're not sure, just check with your practice management system vendor. They should be able to tell you. But as long as you have auto-posting, this downloads feature should work for you. And pretty much today, when you hear me say the word downloads, you can just interchange that with the words auto-posting, because that's basically what it's about. Now, you can click these buttons to go either to the payment screen or to the download screen. It's just a quick way to get there to view those payments or those downloads, and we'll do that in just a bit after I go over the rest of the screen. Now, under here, this is a report center area. These are reports that you can request at any time. You just go and click on the billing or payment detail or request remittances report, for example. You don't schedule these reports. You just, when you want them, you come here and click on them. And there's very specific examples of these reports and descriptions of them in the user guide, but basically you can come here and request those at any time. Billing report's going to show your totals. This request remittances report is really neat. As you're submitting your claims throughout, the time, this report will show you if there's any payers that you are missing out on getting electronic remittances with, but you could be taking advantage of them. So it will show you the remits or the payers that you could request remittances for. So definitely check those out. Now under payment summary, this is a listing of totals for each of the dates, both your ACH totals as well as paper checks. And under recent payers, this shows you the payers whose enrollment has recently become activated. So if there's more than just a few, however, you'll have a more button here, and if you click it, it will show you the complete list. So these are payers whose enrollments become activated, and we're waiting for that remit file to start coming through from the payers. Now, search remittances lets you, it has two options. You can search for a payment or click here to search for a remit. If you have remit selected, This is one place where you could go to search specifically by a patient name, or put in the first few digits of a patient account number, or put in a service date range that you want. Now your remits will be available for up to 2 years on here, so you would want to make sure you've gone back, or it's within the last 2 years. Also, if you click payment, you can search by payment number, payment amount, or payment date range. And under recent notifications, this is where alert messages would pop up from us. So you could click the title and read the messages. When you're done with one, you can archive it by clicking this box on the right, and it puts them behind the scenes. Now you can always click View All to go back and view them again, even if they've been archived. Okay, so that's an overview of your dashboard screen. Now let's say we're ready to take a look at these 159 new payments that I've received. I'll click anywhere on this row, and it takes me to the payment screen. Now something I want to tell you right off the bat, your payment screen, your download screen, and your remit screen. These are the 3 main screens that you'd be using, and they all 3 have the same basic layout. So just to get your eyes used to what you're looking at, first of all, the first area is your search pod area over here on the left. If you click the plus sign or click that box, it drops down your search filter options. If you click it again, it collapses them. You could also click ID search to see your ID search options. Basically, every payment we receive, we assign a payment ID to it. Every download file gets a download ID, and every remit gets a remit ID. So they all get a unique identifier. You know we've assigned the number if it ends in the letters ID. So this is a way of searching with a specific ID. Now that's the first part of your screen. The second part is the body of the listing itself, whether it's payments or downloads or remittances, depending on the screen you're on. Since I'm on the payment screen, it's showing me the payment amounts, the date. Sorry, my mouse is acting quirky. Here's the payer and payer IDs, the type of payment that it is, and the payment number. Now, just a note, if a payment is a duplicate payment, you'll see a little red asterisk at the end of the payment number. So right here next to it, if you see a red asterisk, that means it's a duplicate. It also shows us how many remits are within that payment. And notice those are links that let us drill down to the remit screen with those remits on display. And we'll do that in just a moment. Also to the right, notice every payment has an EOB icon. So if we click it, it pops up a picture of the EOB in this EOB window. So you can slide through and look at all the pages of that EOB. Now at the top, notice you have this printer option, so if you wanted to print it or save it as a file, you could. You can zoom in to get closer if you want to, or zoom out. Now I'll close that EOB window, and that was just by clicking that icon. Now normally in the beginning you won't have this little yellow icon there. That only shows up to let you know that there are notes that have been entered out there about that payment. So for example, if it's not on there, you can go over here, glide over under action, and you'll see there's the note option. So if you click it, it pops up this notepad where you can type in any kind of a new note, or you can view the note history. You can see who entered the note itself. You can see I've typed in some gibberish in the past. Here's a couple sample notes, and it shows you the date and time that the notes were entered. So you see a note history at the bottom. Once a note has been entered, this icon will appear there letting you know there are notes out there. So from that point on, you don't have to use this notes button. You can click that icon and it pops up that same notepad where you can type in a new note or review the history. Now, this U icon on all of mine may not be used by, or you may not even ever see that. That's only going to be there if you have uploaded your remits in a file yourself. Typically, we would receive remit files directly from the payers, but occasionally we have a client that has a remit file that they want to upload themselves, and that's what this Uploads tab is for. It allows you to upload a batch of remits if you needed to yourself. Since all of my training data has been uploaded in a batch, you see all of mine have that U on there. That's just indicating that it was uploaded. But more than likely, you won't see that on yours. You will if you use the Uploads feature. Now, under Action, you have several actions you can perform. We talked about how to type in a note or view the note history, or you can archive the payment if needed. Just click the Archive button, and it tucks it away behind the scenes so that that particular payment would not be on display any longer. Now, once you archive one, this archive option changes to an unarchive option. So what you could do is go to your search filters, and right now I'm viewing only my unarchived items. If I change that to all and hit search, you'll see a few extras pop up here. This file folder lets me know that that's an archived item. And if you glide your mouse over it, it'll show you the username of the person that archived it and the date and time it was archived. So these archived ones, if I glide over to Action, there's the unarchive feature. So if I ever need to unarchive one, I can. Also, let me go ahead and remove these archived items. I'll go ahead and change the view option from all to only unarchived again, and you'll notice the ones with the file folders disappear behind the scenes. So when you archive it, it's like hiding it. It just tucks it away behind the scenes. But this is a paper EOB. You can pop that up. Also, this is a refresh button. If you want, you can click reprocess, and it just does a little refresh that you might want to do, especially if you're going to download. This download button, again, think of that as auto posting. This is a way to auto post this one particular payment. However, I'm going to talk a lot more about downloading in just a little bit, but just know that if you wanted to auto post this one payment, you could glide over to Action, and if you want, you can do a little refresh or just simply click download. Now, that's the second area of your screen. The third area goes along with these check boxes. Notice I can go through here and select specific items. In fact, this is your next page arrow, so I have 14 pages. I'm going to go ahead and select a few more. Pick a couple more here. Oops, didn't mean to click that. All right, so now I've selected some items with the check boxes. And the third area of your screen goes along with these check boxes. Now I can click View Selected, and it takes everything off display except for the ones that I want to focus on that I put a check mark in. So now I'm viewing just those 8 that I selected. And these are tasks that I can perform with those that I've selected. So these buttons across the top are tasks that go along with whichever ones you've put a check mark in. So for example, I can view their EOBs. This will pop up all 8 EOBs in this EOB window. So notice I can glide down and view all 27 pages, it looks like, of the EOBs for those 8 payments. Okay, again, glide to the top if you ever want to print them for whatever reason. I'll close out of the View EOB. Now we can also add a note to all of them. This pops up that same notepad where you can type in a new note and add, and it will add to all 8 of them. Or I can archive all of them or unarchive them. I can even export their data to an Excel file or a PDF file. Just choose the one you want, give your file a name. I'll call this sample 2. And click export. And up here, this ribbon pops up at the top, letting me know it was successful at creating my download file. And if I'm quick enough, I can click that little exports link. But notice that ribbon disappears on its own after a few seconds. That's okay. We can still view that exported file. All you do is just go over to the Exports tab, click there, and it will show your exported files listed on the left. So here's the one I just created today. It's a PDF received today by me. That's my username. That's how I'm logged in, training account, and it shows the status. Now if I want to view the file, just simply click the name, click Save, and click Open, and it'll open it up. It's put it on my other screen, so let me slide it over for you. So here is the PDF file that it just created for those 8 payments, where I could print this or save it as a file, whatever you want to do with that data. If it were a spreadsheet, you could run any kind of queries with that data, whatever you need. So that is how you can export information. Now right now I'm looking at only my exported documents. If I uncheck this box, it'll show other users as well. The whole first page are mine, so let me go to the next page. Here, for example, are a couple that Renee Miller had requested. And here's one from Rebecca. So you can see other users' exports as well. Check it again to view just your own. So that's your export feature. Now I'm going to go back from the export screen back to payments, and I want you to notice when I click on payments, those check marks are still selected. So I can again click View Selected to view only the ones that I have chosen. Now, those check marks are sticky. They're going to remain selected even if you were to log off and go to lunch, or even if I were to log out and go home for the evening. The next morning, they're going to be there still. So you can just view selected and keep working on the items that you've chosen. They're sticky so that you can continue to work with those items, but how do you remove them? Well, you can of course remove them one at a time, or click this X and that will clear out the check boxes. Or this is your checkbox manager. Just hover over this arrow and you can select all checkboxes on all pages, unselect all pages, select this page, or unselect this page. So I could click there to unselect them as well. So that is how you can manage your checkboxes. Now we stopped at export, so that's where we left off. So now I'm going to continue on, but I'm going to skip build. I'm going to jump over that and come back to it after more. I'm going to save build for last. So under more, you simply have 2 additional features. There's that same reprocess that you have over here under action for an individual one. It's just a little refresh. Or I could click go to Remits, and when I do, notice it popped me from the payment screen to the Remit screen. And it specifically has those 8 payments on display. So notice the payment ID numbers are already filled in this box, and they have commas in between them. So if you ever want to search for more than one of something, just put a comma between them. It pre-filled those in because we got here from the payment screen by clicking that Remits button. So all 217 remittances within those 8 payments are what I see on display now here on the Remit screen. So it's just a way of drilling down. I'm going to go back to payments, view those 8 again. All right, so that's how you can drill down to Remit, and it had all of these guys on display. Or let's say I want to view this one remit. I can click that one. It shows me the patient and the payment amount. I can view that EOB with that one patient on there, or I can just go to Remits, click that link, and it takes you to the Remit screen, drill down to that one payment. Okay, so you can easily click those numbers to drill down as well. All of you selected one more time. Okay, so now let's talk about this guy, the build option. Like I said earlier, when we receive your remit files from the payers, you know, there's basically two different ways we can have a download file appear on your download screen. One way is what we call build upon receipt. Build upon receipt means for every payment that comes in the door, we can automatically build a corresponding download file and place it on the download screen for you. So for every payment that comes in, we can automatically build a download file and place it over here on the download screen where it'll sit waiting for you to go there and actually click the download button to auto post it. But I'll come back to the download screen in a bit to go over that in detail. So build on receipt is the way that we automatically have those download files on the download screen for you for every payment we receive. This little button is what we call build on demand. Build on demand gives you much more flexibility to pick and choose what you want to put into your download file. And you pick and choose them with the check marks. Okay, so you select the items, then you go to build, and you have two options. You can build by payer or build by payment. If I were going to build by payer, think about how many files it would build and place on the download screen for me. For these that I've selected, if I build by payer, how many files do you guys think it would build? If I build by payer, well, it's going to build 1, 2, 3 different files. Because even though this says build by payer, it really means build by payer ID. So if you have 6 anthems represented on your listing that you've selected, it's going to go specifically by the payer IDs. So it'll build a separate file for each payer ID. So I have 1, 2, 3 payer IDs represented. So it would build 3 files and place them on the download screen for me, where they would sit waiting for me to go there and click a download button. So we'll go there in just a moment. So that's how you can build by payer. Now if I build by payment, how many files do you think it would build and place on the download screen? If I build by payment, well, it's going to build a separate file for every one that you've selected with your check marks. So it would build 8 separate files and place them individually on the download screen where they would wait for me to go there and click a download button to auto post them. Okay, so that's build upon receipt or versus build on demand, which is this right here. And those are a couple settings that we would go over with you in the beginning. So it's a choice that can be made and set up whichever way you'd prefer. Now, that's your payment screen basically. Now there is a question mark button here, and if you click it, it will pop up this little help window where you can see descriptions of different icons that you may see on your screen, as well as the payment types. And there's the little red asterisk letting you know if it's a duplicate payment. Again, you're going to see that to the right of the payment number. Now I'll close that help area, and of course that's your print screen button. So that's payments. Now let's say I want to go ahead and auto post some of these. Well, I'm going to go to my download screen. This is where again you have your search pod area over here. You have not as many search filters as you did under payments, but you can search by file date or payer, payment number, or view your all versus unarchived items. And you have the download ID or payment ID that you can search with. And then here are the download files that are waiting to be auto-posted. So it shows us the file dates, the payer and payer ID, the format of the file, the dollar amounts, and the number of payments within each download file. Again, those are links to let you drill down to the payments themselves on the payment screen. We can also click View EOB to pop up a picture of the EOB for that payment. Actually, this EOB is for that one payment. This one will have both of those on there. So it's all the files or all the EOBs for all your payments that are within that file. And this is a note icon letting me know that there's a note already out there, which is a little gibberish note, but you can at that point click that to add a new note or come over here to notes. Now when I'm ready to actually auto post this payment, I'll glide to action and click download. When you click download, sorry, I got distracted here. Hang on one second for me. When you click download, at that moment it auto posts those payments into your practice management system. And at that moment that it auto posts, it then archives that download file off the download screen, and it archives the payments off the payment screen as well. So when you do click download, it auto posts the payments into your system, and it actually automatically archives everything after that. So that's how you auto post or download. Again, you can add a note, or there's an archive option. Now, why would I want to ever archive a download file? Well, for example, if there's a, for example, maybe this payment here, someone came in early that morning and actually manually posted that payment. So if that happens, you may want to archive it. So if it's already been manually posted, you'll want to archive it, which just tucks it away behind the scenes like you hide it. Okay? And once again, each download file has these check boxes where you can view the ones that you've selected. You can add a note to them, archive them all, or unarchive them, or export their data to an Excel or a PDF file. Okay? Again, we can click the X to remove all the check marks, and that's your download screen. So that's how you download. You would simply hover over a row that you want to download, and then go to action and click the download button. And again, the moment you do that, it auto posts those payments, however many there are on that row, into your practice management system, and then it automatically archives that row, and it archives the payments from the payment screen. Okay? So that's how you auto post. Let's see. Okay, I'm sorry, I was just reading one of the questions there. Another thing I want to show you that's on all three of these screens, I didn't show it to you on payments, but I'll go ahead and show it to you here. Notice they all have a plus sign. Everybody knows you can click a plus sign and it expands something. Well, you're not limited to just the plus sign. You can click anywhere along the row, actually, and it pops down some details. If I'm on the download screen, it's the download details. If you're on payments, it's the payment details. If you're on remits, it's the remit details. So it'll show you some facts over here. Basically, every download file gets a download ID, every payment gets a payment ID, and every remit gets a remit ID. And if you click those IDs, notice it pops up a little history window, which I don't have any history right now on my demo data, but you would see the history of your download file there. Also, it shows who created the download file and when. If it were downloaded, who downloaded it and when, and if it were archived, who archived it. And it just repeats those icons over here that are under action and at the top there. So you could go through and expand all of them if you wanted to, or just click the rows again anywhere to collapse them. And again, payments has the same feature. So let's pretend I'm interested in these 3 Anthem payments. I'll click that 3. It shows me those 3 payments on my demo data. 2 of them happen to be archived, but I can still just go ahead and view their EOB or read any notes, or I could go to the payment screen and see these 3 payments on display. Maybe I want to unarchive this one. I'll go ahead and go over to Action and unarchive it. So now that file folder disappeared. Now, I can also, like I said, click in the row, anywhere in the row, and it shows you the payment details. Okay? The payment ID is also a link that will pop up a little history window. And if I want to, I can drill down to the Remit screen by clicking these links. I click the 2 and it shows me those 2 remits. I can view their individual EOBs or just go to the Remit screen. And now I'm on the Remit screen with those 2 on display. And notice the payment ID is in there. Well, let's say I'm no longer interested in just these 2. I can close that out, click search. Actually, I think what you do is click the Remits tab, and you can ignore this blue ribbon on my demo data there. But when you click Remits, it just refreshes to the last 3 months, I believe, of receive date. So basically, you again have your search filters here, or your ID search boxes. We can search by Remit ID or payment ID. And then these are the individual patients' remits. It shows you their payment amounts. Now, this EOB icon is for this patient only, but under Action, this one will show the whole payment. So if there's 60 patients or remits within that particular one, you'll see all 60 on this one, but this would be for that one patient. And again, you can add a note as needed. And if you click anywhere on the row, it will show you the remit details. Now, the remit ID is not a link on the remit screen details. Instead, the payment number is a link. It basically, if you click it, will take you backwards from remits to that particular payment on the payment screen. Okay. And again, you have these check boxes where you can select specific payments that you want to focus on. View those that you've selected. You can view their EOBs, add a note, or export their data. And that's basically how the Remit solution works. I believe somebody had a question again about where to look up payers that are on the Remit payer list. You simply go to this Payers tab, and at this moment, there's 3,397 payers on the payer list. You just search for payers by typing in a payer name or put in a payer ID, hit enter or search, and it'll find any payers that are on the list with that name or payer ID. So whichever you want to use. And if the payer shows up there, that means we can receive remits for that payer, or from that payer, as long as you have enrollment completed. So you do have to have enrollment activated in order to receive those remits. Okay? All right. I'm just kind of taking a look to see if there's any other questions that I could answer for you guys. Again, if you have a question, type it in the questions box. If there's a payer that's not on this payer list, you could let VisionWeb, no, it's not something that could be added immediately. There's typically some testing we would need to do on our end at Remit to get payers to be on the listing, but certainly you could pass that information along and we could investigate for you. Okay, well, I don't see any other questions that have not been answered that maybe.
Karen, let's see. We've got a few here at the end that Anna and I are trying to answer via the chat. If you're finished, I may look through them and see if there's some I can address to the group.
That's perfect, yeah, because that's pretty much the training itself. So any questions you guys have, go ahead and type them in, and Shane and Anna can address those, or myself for you.
Okay, you addressed whether to add a new payer. Okay.
Right.
People doing really stuff. Maybe I'll check and see. If I currently go through web, pull EOBs, will I now be able to pull them on Remit? Yes, Linda, we're going through enrollments and doing that paperwork and everything. A lot of times, clearinghouses dump that work back onto the into the client, the end user. But VisionWeb is doing every piece of it that we can possibly do. So there's a few forms that have to have original signatures here and there, but for the most part, we're handling all of it, and we've got a huge effort going to make that happen. Many people. So yeah, you should see your payments flowing over to Remit. To add a pair that is on your list, but it's new to our practice, to contact VisionWeb. So Cindy, the question group was if you want to add a payer to your list, but it's new. It is a payer at Remit. They do have a payer ID, but it's not on your list. Cindy, I'm assuming you're a DDE account, and so yeah, you can create a payer in there. If it's an import account, then it's just a matter of adding it to whatever your PM system is and the correct payer ID. And then that'll come over on the print image and or the 835 file that you upload, and it'll go through just fine. And if it needed enrollment, we'll be told at that point if you can see on the payer list if it needs enrollment. At any rate, it should work just fine, and feel free to give the customer service team a call if you don't think you're enrolled. All right. Let's see. We've had a few questions about rejected files in the test phase, and I want to let everybody reassure you that when we upload a file, you or we upload a file into your Remit account during the test phase. If it rejects, it doesn't necessarily mean that it's not a good file for mapping purposes. So, you know, what they're doing is they're taking the file and telling the computer where to look for certain data. So if it's a valid file but rejected for, say, an invalid diagnosis code, well, that would be irrelevant to the mapping process. It'd be really relevant to the payment process, but the mapping process, it would be just fine. So the fact that it rejected in the test phase doesn't necessarily mean that you've got a problem. Switching from email to Remit. Another question about remits and switching from Inbound to Remit, and about the enrollments. And Karen, yes, you shouldn't have to do much. If you have to do anything, it's sign a few forms that we'll provide. When is the effective date? Michelle, if you could let us know what your practice name is, we can look and see what date if you've gone live or not, and if we've got a mapping file or not. The end date for MD Office is the end of January. So if you've got any rejections in there, my advice to you would be to set aside a little time on January 31st and make sure that all your rejections are cleaned up. And that's really, and print out any EOBs that you think you might, that are still in MD. Some of them you'll find are in both places. Others you'll find are only in ZirMed. You may find just a few, particularly government payers, Medicare, Medicaid. Those are kind of the hardest and the longest to make happen. So if you're in your PM system and you think you might, I'm sorry, you're into MD Office, you might print those out. Print them to a PDF. Okay. See, with the, BJ, I'm trying to read your question. It says, with the dual CL allowed, will MD be auto-terminated when ZirMed starts February 1st? Yes, exactly. And, right now you've got dual usage. You can use MD while we're getting the ZirMed ready. And there'll be a period of time where you're live with both. And VisionWeb, of course, is incurring charges for both, but we're obviously not passing that along. So we're providing dual access and just eating the costs. But on February 1st, yes, all the MD accounts will go away. And a small cheer goes up from my team at VisionWeb. Will Electronic Surgery Center instruments production? Joyce, we need to look up your individual account. We'll do that in a bit. If you did it a month ago, then you should be good. I think people who have done it a week ago are good, so you should be good. Family Eye Center, same thing. We'll look you up. So Kim, we had a question that says, do we have a choice as to manual posting as opposed to auto posting? Kim, absolutely. The auto posting is just an option, quite frankly, that not a lot of people take advantage of. We've our old solution, the MD solution, did have access to the auto posting file. You could pay for access to that auto posting file in the old solution. Almost no one did it. I think it was just lack of awareness, but also they charged for it. MD charged for it, and ZirMed does not. So you'll have access to the files and access to us to help you, and we'll guide you. There's some questions that have to go to the PM system if you're not familiar with auto posting. But the auto posting is just totally up to your discretion. You don't have to download it. You can post your payments back to your system manually if you'd like.
Absolutely. If I could jump in, and if you are going to manually post one, just know that you may want to archive that if it was a file that was created on your download screen. So absolutely. Sorry, Shane, just wanted to jump in there and mention that as well.
No, thank you. Thank you. I appreciate it. Jump in anywhere that you feel there's a need, Karen. You may can help us with this question. Anne asks, will we have the option to key in a secondary claim in ZirMed if the primary payer for the claim was processed in MD? That's a very good question, Anne. Karen, what would you say?
Okay. Well, there's a couple factors there. Specifically about claims, if the submitter is submitting their claims in a batch in the 837 format, then you should be able to send secondary claims in your batches if you are submitting in the 837 format. If you're not an 837 format submitter, say you're print image or pipe delimited, we have a feature called the second link under claims, where it will help you create a secondary claim off of the primary claim that you have submitted. So, but in that case, the primary would need to be in there. So we would need the primary claim in ZirMed in order to create the secondary claim off of it. Okay, so you would have to get the primary in there.
Now, if a duplicate, our plan is to upload a lot of these claim files that have been processed in MDI,
Right.
have them reject so that the data is in ZerMed and then can be amended. Does that help this process at all?
Absolutely. Like you said, just to have that data in there, if the data was in there and accessible on the claims screen, here, for example, on claims, if this was one that was updated just for historical purposes, you could use that second link right here, which is a wizard window that pops up to help you create a secondary claim off of that primary claim that was, sent over. So that's if you're not an 837 format submitter. That's for people that are print image or pipe delimited, that kind of thing. Because print image or pipe delimited can't send secondary claims in a batch file. So that's why we have this second button that pops up the wizard window to walk you through creating a secondary claim off of the primary claim that you have sent over. So that's an excellent, point that and just kind of reinforces how good it is to go ahead and get that historical data out there.
Yeah, absolutely. And if I may, I will go over that one more time because there's confusion still around that topic. And so it bears repeating. We're, once again, we've sent several communications, and during these webinars, I've asked that y'all do that dual upload. And so what that means is that when you go in and log into VisionWeb.com, on that front page, there's an orange button, the bottom half of the screen. It says upload your claims here. That is the bucket, if you will, where we are storing all of your claim files that you are submitting to MDI if you're not live. And then our plan is to re-upload those back into ZerMed at the end of this process. They'll all reject on purpose, but it will allow you to go back and have the data captured in ZerMed that you need to maybe amend, possibly for a corrected claim. So, you may have been doing this every day. If you haven't been doing it every day, it's still okay. Before the end of the process, go back into your records, into your computer, and pull all the files that you want, going back anywhere from 6 months, even up to a year, depending on the payer, if you'd like. Many of you will not find that necessary, but I'm just telling you how far you can go back in order to make sure that you're covered. But and then you can put them into that file all at once if you'd like. But the point is to deliver those files to us prior to January 31st. Okay, let's see. I may have just made things more confusing. I hope I did. Let's see. Linda, yeah. If you if you've got them, the question was, I've got a rejected. I'm sorry for the group. The question submitted by Linda was, hey, I have a rejected batch from MDI, and I've called them. It didn't seem to be going anywhere. Should I just submit it through ZerMed? And my answer to that would be absolutely. Even if you're not live with ZerMed and I was in this situation, I would just wait a couple days because everybody is, we're rapidly getting people live. I mean, so fast that I'm having problems updating people with the info that they're live. It's coming in at that rate. So I would just hold on to them personally and then submit them to ZerMed if you're not already live. Great. And that and also illustrates one of the reasons why we've had it's been a hard go during this conversion, but everybody on the team is very happy about making it because we're looking forward to working with ZerMed and their reputation for excellent customer service is, is pretty well known. So we're very happy to be making this move. I think you'll find the same thing. Okay, let's see if I can find some not office specific questions. And 2 different group MPI numbers. One can review. Linda, I'll take that up with Karen. Or Karen, let me post this question to you while I'm waiting through some of the others, okay?
Sure.
Okay, so a client has the question. I have one tax ID number and 2 different group MPI numbers. And she's saying that she can't view the insurance payments identified by each office MPI like they did in MDI. We now have to pull up each insurance to see which office it belongs to. Is that an accurate statement? And well, first, did you understand the question? And 2, if you did, is that accurate?
Let me let that kind of sink in for a minute. One tax ID, 2 different group NPIs.
Mm-hmm. And they said the exact statement is, we can't view each insurance payment identified by each office MPI like we did with MDI. We now have to pull up each insurance to see which office it belongs to. So can you identify, I guess, the group NPI prior to opening the remit is what I kind of boil that down to. While you're thinking about that one, I'm going to answer another question. Michelle asked that when their effective date for going live, and should they be able to search claims that they've already uploaded to Remit. If you've uploaded the actual, well, if you've not uploaded files since going live, then you're not going to have any claims in there. It's going to look empty because the other submission was in the test mode. Now, we've been doing these enrollments steady for the last 2-3 months. So you probably should have payments over in Remit, but if you have not submitted batches in the live area, you would not have any data in that area yet. The ones that you upload through the orange button, those will all come to the system after February 1st. As soon as we still quit. Okay, did you go ahead?
Yeah, I'm just capturing that question because I'm going to have to research that a little bit. Let's see. I'm trying to understand. So when you have one tax ID, 2 different group NPI numbers, why can't we view each insurance payment identified by each office NPI like we did with MDI? We now have to pull up each insurance. That's where I'm getting confused. Have to pull up each insurance, meaning each remit payer. I'm not following the question here. Pull up each insurance.
Well, maybe we'll reach out to Linda and get a clarification, and then
I'm a little confused about the question.
You, okay.
Thank you.
Unless, Linda, you feel like trying to clarify. Otherwise, we'll give you a call, and you can do so over the phone. It might be easier. And then Karen can research for us, okay?
Yeah. Sounds good.
So I got another question here that will apply to the group. If we are live, are we supposed to be filing claims with Remit the correct way instead of through the orange button at the bottom of the VisionWeb page? Absolutely. The orange button serves as a way to get your data into Remit that you file through MDI. So if you're filing the claim to Remit, yeah, you can stop that process. Okay. These are good questions. I love this portion of the webinar. I think I like the education that you provide, Karen, and I feel like we're getting a lot of good info out there to the group through these Q&A sessions.
Yeah, I think it's good too.
Yeah. BJ asked, as soon as we start going live with Remit, can we stop posting to MDI? BJ, can you elaborate what you mean by posting to MDI? Or you mean pulling your payment files from MDI or submitting claims? The answer is yes, though. If it's claims, you want to, as soon as you go live, stop submitting. And the sooner you can do it, the better. And if you've submitted a mapping file at this point, you're a very short time frame. I'm working from home. If anybody hears my child, I apologize. If you've submitted a testing file, you can confirm with us that is, that we've received it and everything's in process. And personally, if it was me, I would just hold on to my claims at this point, because you'll be live in a short amount of time, and then you can submit them through Remit, and then not have to worry about MDI at all. But that's everybody's own decision, of course. Some people, it may cause, a couple day pause, I suppose. Okay. Linda, I believe, tried to elaborate a little bit, Karen. And she says,
Yeah.
we are able to view our MPI number associated with each insurance line item on MDI. On MDI shows each office MPI number. However, we cannot see our MPI number on Remit.
Is this what you're speaking of?
Yeah, this
Here?
is the same related question to the one that you were addressing.
Because there's the payee NPI number, and you can see it is
Oh,
here
yeah,
on.
I'm sorry, I wasn't looking at your screen. I was looking at the question.
Yeah.
So.
So would that address what you're asking about, Linda? To be able to see that ID? If not, let me know.
No, she said no, just call me. Okay.
Okay, perfect. Thank you, Linda.
Yeah.
Sorry.
I have another question stating, sorry, Linda. Another client asked that I've stated on the 2 previous webinars that, we should have a webinar just of Q&A and give and take and everything. And am I planning on doing that? Yes, Cindy, I sure am. And I'll get with marketing and see, they're the ones that set up the webinars and all the send out the invites and all that kind of stuff. So I'll check on that and see when they plan on doing it. But yeah, I'd like to have just Q&A and see where it goes. And truth be known, if I had to do this over again, I'd do one at the beginning of this whole process too. Really learn. Let's see. Okay. Okay. Duly noted, Sherry. Maybe maybe do both. One as an informative, getting to know the system and questions on how to set it up, and then also one after you get a little experience with it. It's a good point. Great.
Yeah, and
I love our clients. I mean, honestly, we have really good clients. It's a lot of working together, and for the most part, it's a wonderful relationship between us all. Good as a business, and 2 businesses can have. Really like the tone of our clients. So thank you, everyone. That probably sounded cheesy, but thank you.
And Shane, could I jump in one more time? Speaking about the different webinars, I think the one thing that they probably would want to have, and that we talked about offering, and we'll get together to schedule if you like, is the idea of hosting one that goes over the claims listing screen and how to work rejections and work creating, or how to work rejected claims and use work groups. So that's something that we talked about may get scheduled, that may be coming as well.
Absolutely. And the work group thing is added value with this move. That wasn't it wasn't there in the old software, and I find it extremely helpful. So I think that's a wonderful idea. We should have a kind of a running early on, a lot of educational opportunities. There's so much with your system. One of the things I like about the Remit system is that it's robust but not overly complicated. I see, going through all of this, I've vetted probably 6 different clearinghouses, looking at their functionality and the way it's laid out, the experience and functionality. It was just, this was a nice combo of everything. Good functionality, but not overwhelming.
Well, that's good to hear.
Oh, good. And it's the truth. It is the truth. The product that Indion was telling us we were forced to go to, it was, 1, they wanted to double your rate, essentially. And 2, it was so busy and crowded, the screen. It had more functionality than the old version, but it was just very, very hard to kind of wade through everything that was there. I wasn't a fan. And I wasn't a fan of doubling your rate either. So I didn't, glad we made this move.
Somebody, I'm sorry, Shane. I noticed they said they're dying to hit the download button and see how it auto-posts. Well, I'm going to go ahead and download this one just so you guys can see. I'm going to glide over, click download. It pops up this downloads window. I'm going to click go to downloads. Let's see. Okay, that one just popped there. Let me do this. Let me go ahead and select a couple to actually download. So I'm going to go ahead and view those. And I think it'll let me go ahead and build by payer. Here we go. This is what I wanted you to see. When you're ready to download, it gives you this little window. Are you sure you'd like to create new download files? Just click OK. And it tells you with this ribbon that it successfully created your download file. And if you're quick enough, you can click this little downloads link, and it pops you to the download screen. And there's the file I just created with those 2 payments today. So that's how it works. That's how your download files can get here if you build them yourself. Otherwise, the option would be for us to put them there for you automatically. For every payment that we receive, we would build a separate download file for each payment we receive automatically. So happy to show you that, Laurie. So that's how you actually build one.
Very good. Okay, guys. Does anybody else on our side have anything to add? Anna, do you have anything you want to say?
No, I'm good here.
Okay. Well, speaking for VisionWeb, I'd like to tell everybody thank you for attending the webinar, of course. Thank you for your business. Thank you for your patience. I do have emails and phone calls to return, and I'll be doing my best to get to those today, not today, tomorrow. And thank you. And Karen, I'll let you close us out.
Yeah, thank you all so much for your time and attention, and we're so happy to be working with VisionWeb and all of you guys. So, you know, definitely I'll check into this one question that Linda Adams, I'll do a follow-up on that for. But it's great to be with you guys today. Thanks for your time and attention. And if you have any last-minute questions, you could go ahead and put them in. But I'm thinking we'll probably go ahead and close out here. So I don't see anything new coming over. So if you guys have everything for this session, you can go ahead and log off by clicking the X in the upper right-hand corner, and that'll take you right on out of the webinar. So thanks so much, everybody. We really appreciate you and your business, and you guys have a fantastic day.